Professor Paul Hunter, who's an epidemiologist and professor in medicine at the University of East Anglia. Good to talk to you, Paul. So what is the science really saying about limiting our access to bars and restaurants? Does it really make a difference to the spread?
Well, we know that the infection spreads in enclosed spaces that are crowded and where you can't actually socially distance adequately. And that is very clear. And that describes many bars, clubs, and I'm afraid. So, yes, the evidence is quite strong that the infection does spread within crowded bars and restaurants. It's not the only environment where the disease spreads. It can spread in the workplace, and it can spread also within schools. But certainly, crowded bars and restaurants are a place where the infection does indeed spread.
What about this idea of a curfew, though? Is it really possible that, let's say, after 9 p.m., after 10 p.m., the spread is worse? Why does a curfew, or why do they think a curfew might work?
Yeah, it's not because the infection spreads worse after that time. The whole point of the curfew is to actually reduce the amount of time places are open. And the theory is that if somewhere is only open for 3 hours, say, in an evening compared to 6 hours, then that's half the opportunity to spread the infection. The difficulty with that is that what happens in a curfew, if in the curfew the early evening crowd and the late evening crowd just cram in at the same time, then the value of the curfew itself is reduced. And similarly, if all that happens is people drink really quickly, get drunk, and then perhaps go back home with lots of their friends, again, that could also reduce the effectiveness.
So what else, in your view, should governments be looking at? Do you think that national lockdowns are now inevitable?
Sadly, well, I don't think anything's inevitable, but I think it's quite likely that a number of countries will be moving towards national lockdowns as we move up to Christmas, because it's unlikely at the moment that we will be getting the epidemic under control before the end of the year, and we will continue to see rises and continue to see increased stress on our health services, and particularly on intensive care beds.
OK, Professor Paul Hunter from the University of East Anglia, thanks very much for joining us.